Dr. Alec here from Upstate Spine and Sport. I want to welcome you to our first at-home joint training session. I made my setup here pretty much the same setup that anyone can do at home, just on a nice soft piece of carpet or in their basement or living room, wherever's the best spot for you to move around and get some movement in. This is what we're going to use. So for today's class, all we're going to need is some sort of a pillow. I'm using a yoga block that's more of a hard surface, but a pillow will do just fine, and that's all you're going to need today. Today's focus of the class is the shoulder joint. The shoulder has two different major joints when it comes to movement throughout everyday life. The first one is the glenohumeral joint. I think that's when the arm moves on the body. The second joint is the scapulothoracic joint. So that's when the shoulder kind of moves like so, up, down, forward, and back. Today we're going to focus on the glenohumeral joint, so more of the arm moving on the body. Today's going to be a 10-minute class where we just kind of drive through the left arm, and then what I want you to do is you're going to just play back the video all the way back to the beginning and just retrain the same thing that we did right now on the right arm. So then in total you'll have about 20 minutes of work, and honestly it's a great joint training day, and then you can finish up with any type of push-ups, sit-ups, core work that you're following any type of the Orange Theories or any of our local gyms in Greenville that you can do to kind of spice up the rest of the day. So with that said, we're going to go ahead and start with our left arm training the glenohumeral joint. Okay, today's class is the external rotation focus, so that's more when the arm goes backwards like so or backwards like this. External rotation is extremely important in the joint because it's a motion that's needed for it to move well, right? So if I'm picking something up overhead, reaching behind me, or even overhead pressing in the gym, external rotation is needed in order for that joint to do it pain-free and healthy over time. So we're gonna go ahead and train that today, okay? So we're gonna start with cars, okay? I'm gonna have you in the kneeling position. You can be in tall kneeling if this position kind of hurts your knees here, or throw a pillow beneath your knees, whatever's more comfortable for you, but I'm gonna start here, okay? CAR stands for controlled articular rotation. Controlled means we do this motion very slow, articular, which means joint, and then rotation means we're gonna do a big circle with the joint, okay? So we're gonna go ahead and start here with the left arm. The palm's gonna be up, bicep facing you straight ahead here, okay? All I'm gonna do is make some tension in my body, utilize my right arm into a fist, and kind of, brace myself by placing my breath down into my belly and just kind of make myself stable here, okay? What I'm gonna do is just gonna bring my arm forward, keeping the bicep and palm up facing the ceiling. As I get overhead, I'm gonna transition my hand to neutral, and that bicep is gonna face the wall to the right of me. Once I can't get any further, I'm gonna rotate my bicep as if there's an X on it towards the wall to the left of me. So I'm trying to rotate my arm as much as I can. Once I can't rotate anymore, I'm slowly gonna drop my arm down, rotating it as much as I can, slowly reaching behind me as much as I can. Once I can't get any further behind me, I slowly pause and get back to the bottom. So we're gonna go ahead and do 3 reps of this. Palm is up, slowly we come up as high as we can. As I get as high as I can into flexion, my hand goes to neutral and my bicep is facing the wall to the right. Once I can't get any further into flexion, so overhead, I rotate that bicep as much as I can to the wall to the left of me and continue to move backwards, 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 keeping my chest nice and tall and stable as far as I can until I'm reaching behind me and slowly down to the side. One more time here. Palm is up. We slowly come up into flexion as high as I can. Once I can't get any further, I rotate that bicep, rotating the entire arm to the wall to the left. As I continue to rotate, I keep coming around, around, around. My bicep is now almost facing the wall behind me, and I slowly come down to the side. Good. So that's half the rep. Now we're going to go ahead and spin it around and complete it coming back the other way. So what I want you to do is start with the left arm, the knuckles facing your thigh here, and the arms on our side. We're going to come backwards as far as we can. Once I can't go any farther, again, I don't want you to lean forward as you do this. Keep the chest nice and tall. Once I can't get any further, Think of that X on the bicep now. I want you to rotate that bicep as much as you can to the ceiling, rotating it, and then continue to come around, rotating that bicep, trying to the wall behind you, and then slowly back down, just like how we started with the palm and bicep up. Okay? Let's come back down to the side here. Knuckles facing our thighs, slowly come backwards as far as you can. Once I can't get any further, rotate the arm so the bicep is almost trying to face the wall straight ahead of you. Continue to come around, rotating almost as if the bicep is now towards the wall behind me. Palm is up, slowly back down to the side. Last one here, guys. Knuckles facing the thighs, slowly come backwards as far as you can. Once you can't get any further, totally normal for you to feel a big old stretch here. Rotate that bicep towards the ceiling in front of you. Then keep rotating as you come around. Again, not moving any other joint, just the arm. Bicep is now facing my face or almost behind me. Slowly back down to the side. Very good. So not only did we do 3 reps going forward, but then 3 reps going backwards. So that's 3 total complete reps of the glenohumeral car. Okay. Next, we're going to go ahead and progress to capsular cars. So that means is we're just going to rotate the joint at end ranges here. Okay. So how I'm going to have you do it is you're going to bring the arm out into almost like the hugging position. So you're just going to open the arm up. Big thing is here is I don't want the shoulder to kind of come up into the ear like so. This is typically what I see with patients in the clinic, how they compensate for this. So keep that shoulder away from the ear. Just open up that arm as much as you can. Some people can only open it to here. Open it as much as you can. Let's make that hand into a fist, okay? We have our shoulder and elbow at 90 degrees. And what we're going to do is, again, keep everything nice and stable. And we're going to rotate the arm down and back as much as we can at slow, controlled paces here. So go ahead and do this with me. My shoulder is away from my ear. I open my elbow as much as I can. My elbow is making a 90-degree angle. My hand is in a fist. Okay? I slowly rotate my hand and forearm down as I keep the elbow at the same position here. Elbow is not moving, just rotating my forearm and wrist down. Once I can't get any further, I slowly rotate the opposite way, keeping my elbow at the same point, pulling backwards as far as I can. Once you can't get any further, slowly switch. Rotate down into internal rotation as far as you can. Once you can't get any further, rotate backwards into external rotation. Pulling, pulling, pulling. Once you can't get any further, rotate back down into internal rotation. Push, push, push. Again, keeping that elbow at that straight line. I don't want the elbow to drop. Keep it at the 90 degrees. Then we rotate backwards into external rotation. Pull, pull, pull. One more rep here, guys. Rotate downward into internal rotation. Pull, pull, pull. And now backwards into external rotation. Pull, pull, pull. And relax. Good. So now we should already start feeling this area of the body working a little bit and just kind of the deep stuff here. Again, you'll feel a little bit of muscle activation up front, on the side, in the back, wherever your body's just, you know, the most tight or the most underused or just how it's feeling today. That's this type of sensation that you're going to feel. And again, my feeling is going to be different than yours. Yours is going to be different than anyone else at another home. But as long as you're feeling it in this general vicinity, we're right on, okay? So next we're going to go ahead and progress to another exercise. All I need you to do is grab a pillow or something to rest your head on, okay? What we're going to do is we're going to go on to our left side. Okay? So again, we're training the left shoulder, so I'm going to lay on my left side, and I'm going to place my head on some sort of object that lets my head relax here, okay? Big thing here with the setup, guys, is that I don't want the shoulder up in the ear, just like how we talked about when we were in that rotation position. I want that shoulder away from the ear and that elbow at a straight line with the top of the shoulder to the elbow. Okay, so I don't want the elbow down. I don't want it too high. I want it at a nice straight line. Okay. What we're going to do here now is this hand is slowly just going to drop down as far as we can to whatever range of motion that you have. Some people may only be able to get to here. Some people may be able to flop all the way down to the mat. I'm right about here, okay? My upper body is kind of making a nice 90-degree angle with my arm. And again, my shoulder's away from my ear, elbow is in straight line with the shoulder, okay? My hand is flopped down as far as it can, okay? And what I want you guys to do here is we're going to progress by almost doing some contractions here with this bottom arm, okay? So what I want you to do is bring this top arm right up on top of the wrist here, okay? What we're going to do is that we're going to create a contraction with both of these arms. So this hand isn't going to let this bottom arm move, but this bottom arm is going to create, it's called a rails contraction, where it's going to try to make a contraction going this way, okay? So it's going to try to pull the arm into this range of motion, okay? So we're going to bring the arm on top and place the arm here. And now what we're going to do is create some sort of tension with the bottom arm pushing forward, okay? So we're trying to do this motion, but this arm isn't letting it move. We start with a 20% contraction, slowly increase to 40% contraction, and now let's kind of hang around 50% in tension here. So you're trying to push with 50% of your strength, trying to rotate that left arm down towards your knee, but this top arm isn't letting it move. Hold that for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Now, as that arm relaxes, it may be able to get a little bit more motion, but what we're going to do is we're going to flip the contraction, and we're going to do a rails contraction, pulling the forearm down to the ground here, okay? So with 50% strength, go ahead and try to pull that arm downwards into the ground. And again, if your arm is already on the ground, that's okay. Push that arm more into that ground with 50% of your effort. Pushing, pushing, you should feel a little bit of tension in the back part of the shoulder for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. Go ahead and reintroduce that top arm again. Wherever this arm is now in space, some people may have dropped it a little bit farther into range of motion. Wherever it's at, go ahead and meet it with that top arm. And we're going to go back to that Pales contraction of trying to pull the arm this way, but this arm isn't going to let it move. Wherever it's at, let's go ahead and meet our two arms together. 20% contraction, Pales contraction, trying to rotate into internal rotation. Pull. 20%. Let's progress to 40%. And now 50 to 60%. Should be a very safe effort. Shouldn't be too much, but you should feel that bicep, that shoulder, that pec, all that stuff kind of working. Hold that contraction. That top arm isn't letting that bottom arm move for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax the bottom arm. Go ahead and get rid of the top arm, and now we pull ourselves into that rails contraction, trying to pull ourselves deeper into that stretch. Pull, 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 pull. 50% contraction should be a safe effort here. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax and breathe for a second. Very good. We're going to go ahead and move on to our next exercise, still in this same position, but what I want you to do is that I want you to rotate that arm as far forward as you can into that internal rotation position. So keep the elbow where it's at, keep the shoulder where it's at, keep everything where it's at, but you just pull your arm this way as far as you can, as far as it can go. Some people can get their arm all the way down to the ground, some people can get it here. For me today, this is kind of where I'm stuck at, okay? So what I want you to do is bring that other arm now, meet where this arm is, and we're going to do an eccentric contraction of this bottom shoulder. And how we're going to do that is I want this arm to push with 10 pounds of pressure going this way, this arm to push with 10 pounds of pressure going this way. So ideally, 10 pounds equals no motion, okay? So you should feel this bottom arm moving a little, or contracting a little bit. And now what I want you to do is that we're going to lighten this bottom arm up to 8 pounds of pressure so the top arm wins as we open up, okay? So let's go ahead and do that here. So rotate your arm as far as you can. Bring the top arm into the play here. And let's go ahead and meet each other with 10 pounds of pressure. Both arms are pushing into each other, but no motion is happening. Now, the bottom arm only pushes with 8 pounds of pressure. So the top arm wins. Keep pressure as we open up as much as our shoulder can get. Keep pressure. Keep that 8 pounds on the bottom arm. Keep the 8 pounds. Keep the 8 pounds. Keep the 8 pounds until we get as far as we can. Once you can't get any further, pause and relax. We come back up to that position. We have 5 reps here, okay? So that was 1. 10 pounds, 10 pounds. Slowly go to 8 pounds with the bottom arm. Top arm wins, but the bottom arm is still working for 5, 4, 3, 2, 1, and relax. Bring it back up. 10 pounds and 10 pounds. And bottom arm goes to 8 pounds. 6, 5, 4, 3, 2, 1. Relax. 2 more here. Pull that bottom arm into internal rotation as far as you can get. 10 pounds and 10 pounds. Slowly go to 8 pounds with the top arm. 6, 5, 4, 3, 2, 1, and relax. Last one here. Bring that bottom arm as far as you can. Meet the top arm. 10 pounds and 10 pounds with each arm. No motion is happening. Now that bottom arm goes to 8 pounds of pressure. Top arm wins for 8, 7, 6, 5, 4, 3, 2, 1, and slowly relax. Very good. Go ahead and come back up into that kneeling position that we started in. Right now, the shoulder should definitely feel like it's been working a little bit, right? It should feel a little bit fatigued, but should feel pretty good. It should feel more like a floppy arm where it feels almost Gumby, where you have a little bit more motion here, okay? So we're going to spin back to our cars and finish the same way we started, okay? So palm is up, doing our glenohumeral car, creating tension into the system, trying not to move anywhere else in the body. Palm is up, bicep is up, slowly we come up as high as we can. Rotating to neutral with the hand. Once I can't get any further, rotate this arm, rotating the bicep towards the wall to the left of me as far as I can as I reach behind me, keeping my chest nice and tall, and down to the side. Back up. Rep number 2. As far as I can into flexion. Rotate the entire arm towards the wall. Continue to rotate as I bring the arm behind me. Reach, 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 and back to the side. Last one here, palm is up. Going as high as I can. Reaching overhead, trying to make the circle every single time a little bit bigger than the last. Rotate the arm, rotating the bicep towards the left wall. Continue to come around. Back, 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 and down to the side. Good, now let's finish up those reps. Knuckles are facing our thighs here. We come backwards as far as we can. Rotate the arm so the bicep is facing the ceiling in front of you or the wall in front of you. Continue rotating it until the bicep is now facing the wall behind you. Palm is up and down to the side. 2 more times here. Knuckles start at our thighs. Reach backwards as far as you can. Feel all this stuff stretch. Keep the chest tall. Rotate the bicep as far as you can. Continue to come up. Reach, 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 and slowly back down. Last one here. Knuckles to the thighs. Slowly come backwards as far as you can. Rotate the entire arm. Continue to rotate as you bring the arm up and overhead so that bicep is facing you, facing behind you. slowly back down to the side. Very good, and let's finish with our capsular cars, okay? Start with our elbow at 90 degrees. We open as far as I can. Remember, keeping the shoulder out of the ear. Once you open as far as you can, elbows at that 90-degree angle, hand is in a fist. Keep the shoulder and elbow exactly where it's at. Let's rotate down to internal rotation. Once you can't get any further, give it a little extra push, and then flip, go back to external rotation. Again, contract at the very end range, flip to internal. Feel like you're going through mud here, guys. Nice and slow with the motion. Keep tension into the system as you keep the same tempo, 1 mile per hour, and continue to flow through this. Downwards and internal rotation. Pull to external rotation. 2 more each way, guys. Downwards into internal rotation. Flip backwards into external rotation. Last one, slowly to internal. Flip, slow going back to external. Pull, 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 and relax. Awesome. Well, again, you just completed your first at-home joint training session. What I want you to do is pull that playback all the way back to the beginning. Rinse and repeat, but with the right arm, okay? And then with this segment, it will be about 20 to 30 minutes worth of work, and again, that's a great at-home training day to kind of keep the joints healthy, especially during these weird times that we're going through. So great job today. Please comment, share this to anyone that you feel would be interested into this stuff, and we'll continue to roll out some spine segments, some hip segments, and some ankle stuff. I know that it's a lot of stuff that people were interested in and want to get some work in. So let us know what you think, and hope everyone's staying safe, and looking forward to see you guys soon.